Hello, everyone, and welcome back to our channel, focused on navigating health and wellness after 50. We talk a lot about getting enough sleep, but what if how you sleep is just as critical, potentially even life-threatening for some? It sounds dramatic, but doctors are increasingly warning about one specific sleep position that could significantly increase health risks, especially for seniors. Could your preferred way of sleeping be silently setting the stage for serious complications, linked even to sudden death in individuals with certain underlying conditions? This isn't about scaring you, but about empowering you with crucial knowledge. Stay with me as we uncover which position is raising alarms and why it becomes riskier as we age. Why does sleep position suddenly become such a critical factor after 50? Several age-related changes come into play. Muscle tone naturally decreases, including in the throat and airway, increasing the risk of conditions like sleep apnea. The prevalence of cardiovascular issues such as heart disease and high blood pressure rises with age. Gastroesophageal reflux disease, GERD, or acid reflux also becomes more common. These factors mean that certain sleep positions, which might have been harmless in younger years, can now significantly exacerbate these underlying conditions, putting strain on the respiratory and cardiovascular systems during the vulnerable state of sleep. Understanding these changes helps us appreciate why optimizing our sleep posture is vital. The sleep position causing the most concern among medical professionals for the 50-plus population is sleeping flat on your back, also known as the supine position. While it might seem comfortable or natural for some, lying flat allows gravity to work against your airway. For individuals prone to certain conditions, this can be particularly dangerous. We'll primarily focus on the risks associated with back sleeping, as this is where the most serious potential complications, including those linked indirectly to sudden adverse events, often arise, especially if underlying health issues are present and untreated. We will also briefly touch upon potential issues with stomach sleeping later. The biggest danger of sleeping flat on your back, especially if overweight or with naturally narrower airways, is the worsening of obstructive sleep apnea, OSA. In the supine position, gravity causes the tongue and soft tissues in the throat to collapse backward, obstructing the airway. This leads to repeated pauses in breathing throughout the night, causing oxygen levels in the blood to plummet, hypoxia. These frequent oxygen drops put immense stress on the entire body, particularly the heart and brain. Many people have undiagnosed sleep apnea, and sleeping on their back makes this potentially life-threatening condition significantly worse, increasing the risk of severe complications. The chronic oxygen deprivation and stress caused by apnea, worsened by back sleeping, directly impacts cardiovascular health. The repeated drops in oxygen and surges in stress hormones can lead to high blood pressure, irregular heartbeats, arrhythmias, and increase the long-term risk of heart attack and stroke. For individuals with pre-existing heart conditions, this added nocturnal strain can be particularly dangerous, potentially triggering acute cardiac events during sleep. Furthermore, sleeping flat on the back can also worsen symptoms of GERD, as gravity no longer helps keep stomach acid down, leading to discomfort and potential esophageal irritation. While perhaps less directly linked to the severe risks associated with back sleeping and apnea, sleeping on your stomach, prone position, also carries risks, especially after 50. This position forces you to turn your head sharply to one side, putting significant strain on the neck and potentially leading to pain, stiffness, and nerve compression over time. It can also flatten the natural curve of the spine, contributing to lower back pain. Furthermore, sleeping face down can restrict breathing simply by compressing the chest cavity and making diaphragm movement less efficient. While not typically linked to sudden death, like apnea complications, it contributes to poor sleep quality and musculoskeletal issues. So, what's the safest way to sleep, especially if you have risk factors? Most experts recommend side sleeping. Sleeping on your side helps keep the airway open, reducing apnea severity. Sleeping on the left side may be particularly beneficial for digestion and circulation, and is often recommended for those with GERD or heart conditions. Use pillows strategically. Place one between your knees to align hips and reduce back strain, and ensure your head pillow supports the natural curve of your neck. If you struggle to stay off your back, consider positional therapy devices like special pillows or alarms, or even the old tennis ball in the back of the pajama top trick. Most importantly, if you suspect sleep apnea, snoring loudly, gasping, daytime fatigue, get tested and treated. While the thought is alarming, knowledge is power. Understanding how sleep position can impact health risks, especially those related to sleep apnea and cardiovascular health after 50, allows us to make safer choices. If you often sleep on your back, especially if you snore or have other risk factors, please discuss this with your doctor. They can assess your individual risk and recommend appropriate action, which might include a sleep study. Prioritize side sleeping and optimize your sleep environment. What position do you usually sleep in? Did this information make you reconsider? Share your thoughts below. If you found this video informative and potentially life-saving, hit like, share it with everyone you care about over 50, and subscribe for more crucial health updates. Sleep safe.